we have to take care of them just like we take care of our own body. A body requires a good bath every day. We brush our teeth, we take care of our hair, we cut our nails, and we have a shave, and when we defecate or urinate, we keep our orifices clean, we wash our hands before meals. So this is the same thing the patient also needs, but unfortunately patient is bedridden, is not able to take care of himself or herself. So we have to keep the skin meticulously clean. The patient is lying on a bed for continuously, so we have to change the position. We can use an alpha bed or a water bed, and that will give the equal distribution of the pressure across the skin surface, and the pressure points can be padded well, like the shoulder blades, the heels and the buttocks. And then we can use diapers and other things, because they don't have a sensation of urination or defecation. So whenever they pass motion and urine, we have to keep the area clean. The area should not be moist, it should be dusted well with some medicated powder. And then the mouth care should be good. The saliva should be sucked out, or the patient should be taught to swallow. And then nutrition has to be taken care of, because they cannot take care of themselves. We have to provide them a balanced nutrition. This way, even paralyzed or bedridden patients, we have seen they are very well maintained for almost 5 to 10 years on bed. But it involves meticulous nursing care. There's little a doctor can do, but a nurse or a personal attendant can do a great deal of good work.
I think this is a very important question, because caregivers are often exposed to a variety of stresses, particularly the financial aspect of caregiving. It might be very costly to take care of someone who is bedridden, the drugs, the physiotherapy, the airbed and other requirements that come along with that. The emotional aspect of caregiving, where you feel you have emotionally invested a lot in one person, and when that person is bedridden, a part of you goes along with him. And so the financial, emotional, the time, the various resources go into caregiving. So when we look at it from all these angles, it is quite natural that caregivers suffer a lot of psychological stress and eventually lead to burnout. I think what's important is for a person, say for example, who's having his aged father, aged mother, or some other sick person in the family, I think they need to get in more people, mobilize social support. The same person cannot be expected to discharge his duties efficiently for multiple bedridden patients or multiple patients who require care. Those are the situations in which one caregiver is likely to feel overwhelmed, frustrated, and eventually burnt out. So I think bringing in more helping hands to the situation will definitely ease it. Secondly, the caregiver has to have some time away from the caregiving activities so that he can focus on his personal well-being also. So a timetable can be given for the caregiver, where a fixed amount of hours is definitely allotted for caregiving, but some amount of time is also given for personal rejuvenation activities. That kind of a balance has to be brought in, and along that the doctor can advise, as they are advising for the caregiving aspects for the bedridden patient, at the same time the doctor can also give tips to the caregiver how to balance the caregiving and other aspects, so that we can preempt this possibility of caregiver burnout.
The caretakers of bedridden patients, terminally ill patients, are often very much stressed, and seeing somebody suffering in front of your eyes and dying, the process of dying can be very, very stressful. They undergo a lot of stress themselves, which is actually a known medical condition, caregiver stress. To know the prognosis, to provide the care, and at the same time appear happy to the patient and make the patient happy, they need a lot of mental strength. Caregivers should be mentally very, very sound and stable to be able to do this. They require help and support from the health professionals, as much as possible training to take care of all these ailments, and regular mental and psychological counseling, and if possible meditation, and to be strong.